morning. It is now May 7th, 2026. We're streaming live from Duke Spine Institute. Our patient travels from Arizona. He has 4 herniated discs in his neck, but he's chosen to fix only one, the worst one, which happens to be the most difficult to get to, number 6-7. But he's got a large herniation on the right side. He's losing function in his right arm. We're about to do our discogram shot. And you can see shot the tear in the back of the disc, and the dye is basically not migrating out that much because shot he's got a lot of scar tissue back there. That's the reason. Hold that. Scar tissue comes with inflammation. Why is there inflammation? Because herniated discs cause inflammation. The amount of inflammation they cause varies depending on the patient. Some patients get a lot of inflammation, some get very little. If you're a patient who has a lot of inflammation, you're going to have more symptoms. For example, you're going to have more pain in the neck. You're going to have more headaches, more symptoms of pain radiating to your shoulders. Shot? This patient has it all, particularly right arm symptoms. And that's because the herniation is mostly on the right side. I'm going to remove my needle. I'm going to place my dilator over the guide wire to get down to the front of his disc. We are not cutting anything in his body. We cut his skin 4 millimeters. That's it. This is the least invasive surgery you can do for a herniated disc in the neck. Sean? We've done now 2,762 Duke laser disc repair surgeries. That's 2,762. This patient will make number 63. Sean? You can see on the lateral view, Jordan, let's count. We're at C2, 3, 4, 5, 6, 7. We are at C6-C7. That is the disc we're supposed to fix today, right, everybody? Yes. Remember, he's got 3 other ones we're not fixing, but he'll come back in the future for those. Let me know when you're ready, Jordan. And shot. That's nice. We're a little bit on the left side. You can see the herniation. You can see the tear. What I'm going to do is I'm going to come out with my guide wire, lateral, and I'm going to move just a little bit to his right. Shot. Shot. AP. See if I can get us centered up just a little better. Shot. That's great. We are literally within 5 millimeters of the center of his spine on the AP view. That's exactly where I want to be. I'm entering his disc. People ask me, Dr. Duke, when you go through the front of the disc, don't you poke a hole? The answer is no. Just like you take a little pin, P-I-N, and you put it through your clothing, your shirt, you know, for example, if you have a little pin that has a smiley face, you want to wear it on your shirt so everybody could see you're a happy-go-lucky person. That pin does not make a hole in your shirt. It just pushes the cloth aside, that cotton fibers aside, okay? I'll show you in a moment. And by doing that, you are basically spreading the fibers apart. And at the end of the surgery, you're going to put all those fibers back. Shot? I'm just bringing my tube down over my dilator, which we're now there. And you can see the dilator has moved back a little bit from the back of the disc. The tip of this dilator, show them, Jordan, is now right inside the annular tear. See the tip right there? That is at the back of the disc, right where I want to be, where the herniation is. Now what's happening is the dilator is getting pushed back because, you see that? It moved back again because of the inflammation. Oh, yeah. There's a lot of hydrostatic pressure inside this disc from inflammation. The inflammation is coming from the patient's herniation. So Dr. Berndes, We can let all the relaxation go and get him close to being ready to recover. We'll be done in about 10 minutes. You can see the dilator has pushed back yet again. I can feel the resistance within the tear and the herniation. It is pushing this tip of the dilator back towards me. It doesn't want to stay in there. And that's because of the massive amount of inflammation going on in the back of this disc. All right, that's perfect right there. We're done. We're going to get started with our endoscopic laser surgery. Let's show the audience the 30 different causes of neck pain. When people have neck pain, there are 30 things that cause neck pain. They're very specific. So watch this video. You'll learn about the 30 specific sources of neck pain. I'm Dr. Deukmedjian, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, welcome back. You can see inside the tube we have a piece of herniation right there. It's so big it's not even coming out of the tube. Remember, the tube is 2.8 millimeters wide. So it's really hard to pull the herniations out. Check this out. Anthony, show the audience the herniation. I just took another one out too. Look at how big that thing is. It is a big one. That's about 6 millimeters long and about 5 millimeters wide. So that is part of the herniation that was pinching his nerve and spinal cord. Did you see it, Anthony?
Yes, we see it.
You use the up camera above?
Yes.
All right, good. Going back in, endoscopically. Remember, we're at 6-7. A lot of herniation here. All this blue stuff, herniation, white stuff, scar tissue from the herniation. Gold color is calcification from the chronic inflammation from the herniation. But this is all herniation right here. And there's a lot of it. This is his most herniated disc, 6-7. All right, any questions about the 30 different causes of neck pain?
No questions.
So what is neck pain? People have neck pain, and you're going to get the wrong diagnosis 95% of the time from doctors. The reason is they don't know the causes of neck pain like we do at Duke Spine. We pioneered diagnosing neck pain, and we actually have discovered not just the 30 causes, but the incidence of each of them. In other words, how often they occur. The primary cause of neck pain, chronic neck pain, which is neck pain more than 2 weeks, that's what chronic means. The primary cause of chronic neck pain is disc, the disc injury, an injured disc. And it's typically 2.5 discs on average, not one, but 2.5 discs that are causing the neck pain. So when your doctor tells you you need one disc repaired or fused, there's a high likelihood they're under-treating you and that you're going to have to come back and get a second disc operated on in the future, which is unfortunate for the patient because then the patient has to have more than one surgery, right? Who wants to have neck spine surgery done more than once? I don't. I want everything done in one shot. Now, patients sometimes choose to have just one thing done at a time, and that's their choice. But people should be at least offered the option of being able to have everything fixed. Okay? That's the right thing to do in medicine. It's not to string out people's surgeries and treatment over months and years and treat them like an annuity. Unfortunately, in the United States, insurance companies have a policy where they only cover one treatment at a time. So if you're a doctor trying to fix a patient and they have 3 things wrong and you try to do all 3, the insurance companies punish you. They don't pay you for the second and third thing you're fixing. They only pay you for one. And that's universal with all insurances that I've come across. Blue Cross, Cigna, Aetna. They want the patient to have to come back a second and third time because they know that the compliance by the patient is low, meaning the patient will not come back a second and third time. They will just do once, have a bad result because the doctor only fixed one thing, and then they'll get discouraged. The patient will be so discouraged they don't want to come back and do it again. I just gave it to you. That was another big piece of herniation. So we are racking up removing pieces of herniation. I got 5 minutes left. Let's show the audience how the Duke laser disc repair, how people get neck pain from a herniated disc, and how the Duke laser disc repair works.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK-349.
You can see from our video that the disc injury causes pain through a process of inflammation. What happens is the patient injures their neck, they tear the annulus. Once the annulus is torn, which is your ligament holding your bones together in your neck, in your spine, once that annulus is torn, then pieces of herniation can escape, and the herniated nucleus gets stuck inside the annulus, and it causes massive inflammation. That inflammation in turn causes horrible neck pain, headaches, and arm symptoms. This was discovered at Duke Spine Institute by myself 20 years ago, long before anyone else knew how a disc herniation was causing so much neck pain. Any questions from our audience?
No questions.
All right. Well, keep going. Let's show the audience then how the Duke laser disc repair works to get rid of this neck pain.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
You can see from our video, we can repair discs using a laser and an endoscope. That's what you're watching right now. This procedure is called the Deuk laser disc repair. It's peer-reviewed and published, FDA approved, and I hold several patents related to technologies. So, if you want the very best treatment for a herniated disc in your neck, you come to Deuk Spine. All right, any questions?
No questions.
Probably another minute or two, Berndes. This patient has so much herniation happening at the back of this disc that it's taking us longer than normal to remove it. Fuck. Come on. You're talking about the second patient? The IV? Was it an issue? But was it challenging?
Well, yeah, I got it like relatively easy, but it's kind of close to the wrist, so we try to.
All right, about 30 seconds left. We should be good. Got to keep it facing that way, otherwise this scope will pull the tube out because it locks. You understand? Fucking crap. All right. Which direction? This way? Any questions from our audience there?
Yes, we have one question from Archie on Facebook.
Uh-huh.
Hello.
Hi, Archie.
Will Blue Cross insurance work for laser surgery for herniated disc? I live in Washington State. Thank you.
That's a great question. We don't know, Archie. We don't have a contract with Blue Cross here at the surgery center. So whether they pay or not is really up to your plan, how good it is, and how much effort you put into getting it paid. So that's going to really be up to you. All right. Done.
Sitting down, please. Thank you.
Fuck it. I don't care. All right, we're going to go ahead and put a bandage, but you can see the entire surgery is done with a small 4mm incision. You can go ahead and end the stream. We'll be back shortly for a second case that is 2 discs, not 1 but 2. And good morning, I'm Dr. Deukmedjian at the Duke Spine Institute. I'm here with my patient who traveled to Duke Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4mm. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Duke Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, do you have a herniated disc? I can fix you. And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, you're done already? The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Duke laser disc repair and the Duke plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.